But this system is what is called as a navigational bronchoscopy system, which complements the traditional bronchoscope. In simple terms, a bronchoscope means a tube that can look into the airway. The word bronchus in Latin means airway, and to scope means to look inside the airway, which is used to go into the airway and try and identify different problems that could be having with airway diseases or lung disorders. But the trouble with a flexible traditional bronchoscope, because of its size, is that it cannot go deep into the lungs. A navigational system is an adjunct to the flexible bronchoscopy system, which helps us go deeper into the lung tissues via the airway and perform interventions in difficult to reach locations in the lungs. Just like you have a car and you plug in the address once you get into the car, and it tells you the road map. It builds a road map for you how to travel there, and it starts telling you go further 1 mile and take a right turn. Then you go further and you take a left turn. Sometimes you go further away and you take a U-turn. Similarly, what this does is you take a CT scan of the patient and you identify the tumor, which becomes the target to biopsy, and you put it into a software, and then you design that helps generate a pathway like a GPS does. So it takes the airways as the road, and you travel into the airways to get to that tumor. So this is just a little example of what tumor sizes can be. As you can see on the diagram, they can vary from being very small to very big. Typically, when tumors are greater than 3 centimeters in size, they become a higher stage tumor. The larger the bigger tumor, the higher the stage becomes. The idea of getting lung cancer at stage 1 is when the tumor is less than 3 centimeters in size, which means we have to target these small nodules, the size of basically a pea or a peanut. And that's when we can make a difference in the patient's outcome and management. Typically, when we do the navigational bronchoscopy, we reach the target spot and then use instruments to biopsy that spot. This is sent to the pathology laboratory, and then the pathologist determines whether this is a cancerous growth or not a cancerous growth. Not every spot in the lung is a cancer. So this screen is in 2 parts. On the left side, what you're seeing is the scope being driven into the airways, but on the right side, the green dot is the target in the patient where there is a spot in the left upper part of the lung. And this is in a patient where there is concern for cancer. As you can see, the bronchoscope travels along the purple line, and that's the GPS pathway created. We drive into the airway, get to the spot when we as close to the spot as we can, and then biopsy from there on, puncturing through the airway into the target lesion. Okay. This is a fluoroscopic image of a patient who underwent a successful navigational bronchoscopic biopsy. The target lesion was sitting on the aorta, one of the biggest blood vessels taking blood to the entire body from the heart. So there was a lot of nervousness to biopsy this under radiology guidance. We navigated into the upper lobe, and you can see the bronchoscope sitting across, and through the bronchoscope we managed to pass in tools that can go up there, and that's a guide sheet sitting, locking us in position to the nodule, and then we perform biopsies. It came back positive for cancer, and the patient was then successfully treated.